Hello, everyone. My name is Salim Hayek. I'm a cardiovascular specialist in cardio-oncology and the chair of the American Heart Association Cardio-Oncology Subcommittee. Joining me today is my dear friend and colleague, Dr. Amelia Langston, who's a co-author on the statement. Dr. Langston is a prominent physician scientist and the director of the bone marrow transplant at the Emory Winship Cancer Center. Dr. Langston, what can you tell us about contemporary bone marrow transplantation?
The transplant process you can think of as happening in phases. The transplant begins with what we refer to as conditioning therapy, which is typically high doses of chemotherapy, sometimes in conjunction with radiation. And then after that is complete, the patient receives either their own or the stem cells from a donor, typically derived from the bloodstream. What follows over the next couple of weeks is the aftermath of the high-dose chemotherapy. The patient becomes pancytopenic, requires blood and platelet transfusions, antibiotics, and this is really the first stress test of the transplant because patients can get very, very ill. They can experience sepsis. They can also have massive fluid shifts. They can have arrhythmias. About 10% of the patients have to go to the ICU for one thing or another. And so it's a very intense period. Then once those stem cells engraft, then we enter the follow-up phase, which is done in the outpatient setting typically. And then finally, we enter survivorship, where we monitor patients both for cancer-related and non-cancer related complications.
As you highlighted, the incidence of cardiovascular complications in transplant differs in the sense that there's the peri-transplant period and then there's the long-term survivorship. The transplant process has evolved significantly, right, in the past decades. You used to administer a lot of high-dose chemotherapy, anthracycline, cyclophosphamide, total body irradiation, but now this is not as commonly done, correct?
Well, it is true that we have more options in terms of the severity of the chemotherapy and radiation that we deliver, but we still do transplants. The chemotherapy can still be very, very severe, particularly for our younger patients and patients with aggressive malignancies.